The ScalpelCric from VBM, a surgical set for cricotireoidostomy according to the scalpel technique, based on the simple description of stab, twist, bougie, and tube. The ScalpelCric is meant to facilitate the execution of the scalpel technique. The set is packed in a specific sterile pouch, with each component organized in the order of use. The set consists of a scalpel number 10, a 14 French bougie with angled and rounded tip, a 6mm cuff tube with smooth tip, an extension tubing, a syringe for cuff inflation, and a neck tape for tube fixation. Hyperextend the patient's head. Locate the cricothyroid membrane by the palpable depression between the thyroid cartilage and the cricoid cartilage, and stabilize this site with index finger and thumb. Make a horizontal stab incision through the skin and cricothyroid membrane using the scalpel. Keep the scalpel perpendicular to the skin and turn the sharp edge 90 degrees caudally. Maintain gentle traction, pulling the scalpel towards a U. Open the incision and keep it open for the insertion of the bougie. Swap hands and hold the scalpel with your left hand. Slide the bougie down the scalpel blade into the trachea. Rotate the bougie caudally and advance gently up to 10 to 15 centimeters into the trachea. Remove the scalpel. Hold the bougie and railroad the tube gently over the bougie into the trachea until the flange is flushed with the patient's neck. Lubricate the tube if required. Remove the bougie. Make sure that the position of the tube is not changed. If required, the tube can be repositioned after loosening the flange. Then tighten the flange to prevent axial dislocation of the tube. Inflate the cuff to the minimum pressure required to seal the trachea. Check the cuff at regular intervals. Connect the tube to a ventilation system and ventilate the patient. Verify correct placement and successful ventilation at regular intervals by a suitable method. Place the neck tape around the patient's neck and connect it firmly to the flange. Check the tube for secure hold. Tracheal suctioning is possible through the connector of the extension tubing with a suction catheter, similar or smaller 16 French. Make a midline vertical skin incision. Use fingers to separate tissues. Try again to identify and stabilize the cricothyroid membrane. Make a horizontal stab incision through the cricothyroid membrane and proceed with the scalpel technique to complete the cricothyroidotomy.